This portion of New Day Northwest is sponsored by the Polyclinic.
Breast cancer treatment takes its toll on a patient's body, especially for women undergoing mastectomies. An innovative procedure called the deep flap procedure is a way to have breast reconstruction after a mastectomy without an implant. Here with more is board-certified plastic surgeon Dr. Cindy Way from the Polyclinic, and also here her patient, breast cancer survivor Ruth Barefoot. How you doing? Things good?
Great.
Excellent. Isn't that nice?
Completely clear.
Yes, good for you. That's what we want to hear. Dr. Way, what are the options for breast reconstruction after mastectomy?
Yeah, so I think it's really important for women to realize that they have several options after a mastectomy, one of which is to not have reconstruction or to defer that decision to a later point, because reconstruction can be done pretty much any time after a mastectomy, so it's not necessarily something you have to decide on right away.
And you have other things on your plate.
Exactly.
At
Yes.
that point, so it's kind of nice to wait if you can. DEEP is one of the procedures. Tell me what that is, what's involved.
So the deep flap is, it's a swath of tissue that we take from the lower belly and transfer it up to the chest to reconstruct the breast. It's quite a large piece of tissue, so it needs a blood supply to survive, much like any other part of your body. So it involves the use of microsurgical techniques to keep the tissue alive after it's been transferred. It's much more complex, excuse me, much more complex surgery than implant reconstruction.
Is it multi-stage? Can you do this all at once, or?
You can do it all at once, but typically it involves one primary stage where the deep flap is done and the tissue is transferred up to the chest and good blood flow is ensured. And then in a secondary stage, there may be some fine-tuning of the result to improve the shape or symmetry with the opposite breast.
And so what is used for the tissue that fills the breast?
The tissue is taken from the lower belly. That tissue, it's actually the same tissue that's removed during a tummy tuck operation. So an added benefit of the procedure is that you get an improvement in the abdominal contour
That
as well.
is not bad. You should get something if you have to go through breast cancer, right?
Exactly.
There should
Silver
be
lining.
some silver lining. Tell me, Ruth, about your diagnosis and how you decided on your treatment.
I was diagnosed with breast cancer in my left breast, and after Cindy Way, she basically did a CT scan, asked for a CT scan, and found lymphoma, so a second primary cancer.
Wow.
And because of that, the whole idea of surgery and a lumpectomy turning into a mastectomy, a double mastectomy, is what I decided to do. And so the reconstruction actually really needed to be thought out from that point.
And did you have any concerns about the procedure?
I wanted to make sure that I was as healthy as I could be going into the surgery so that my recovery would be quite solid. And just getting the coaching through that process was really an important piece.
Did you choose the deep flap?
I did. And I chose it over, say, implants because I wanted to stay organic. I didn't want foreign bodies in.
I can understand that, especially when you've gone through treatment for an illness and you think, you know, let's just work with what we have here.
Yes.
And so what was the recovery like for you?
It was pretty smooth, but a lot of work on my part and you know, my docs. There was a lot of patience needed, and I had to just keep focused on the primary goal, getting through it and getting into the reconstructed phase.
Would you have any advice for other women who are facing these choices?
Great question. I've been joking that my hydraulic bed was primo because you can't roll over, you can't lay on your side for several months. And so having that comfort during the recovery process through those phases was so important. Plus all the great coaching and everybody on the staff just cheering you on. You know, there's just a lot of stitches, but there's also you know, a great result.
And this is one of those things that gives us hope because there are constant improvements that if you have been through breast cancer and known somebody who had 30 years ago, this is a whole new world.
Yes, absolutely. We're constantly striving to make improvements in this procedure, even though it's been around now for some time. Some of the newer things that we're doing are trying to reanatomize sensory nerves from the flap to sensory nerves up in the chest to try to provide some return of sensation within the flap.
Well, you guys are doing a good job, and I'm so glad you're well.
Thank
and
you.
You look well. For more information on the DEEP procedure, as well as other reconstructive procedures done at the Polyclinic, please visit polyclinicplasticsurgery.com. We'll have that on our website, too, and we'll be back.